I am so excited about whom I'm going to introduce you all to. You know him because he's a parent here. Dr. Michael Johns has an 8th grader and a 10th grader, Ethan and Ari. He also is one of us. He is a 1987 alum from Mountain Sales Academy. And in Middle Georgia, he is renowned as the foremost expert on working with students on the autistic spectrum. He currently is the director of the Autism Center at Madison Health, and he has generously offered to share his time and expertise with us. So I present to you all Dr. Johns.
I am not the director.
Oh, sorry. You should be.
The director comes up here. I did go to Mountain Sales, and I went a variety of other places before I finally decided to stop going to school. I got 2 master's degrees and a doctorate, and then did a fellowship at Children's Healthcare of Atlanta. But what started me on the road to wanting to work with children and autism was when I was in Arkansas. And this nice OT asked me if I would participate in a group. It wasn't a social skills group, it was a group for OT. So she had a lot of balls and stuff like that we were supposed to use during the activities. But during the time I experienced the group, I found that they were talking to each other at the time that they were doing all these activities. I thought, wow, that's really cool. I mean, they're like bonding over jumping on trampolines and things like that. So, and I do currently run social skills groups, but when I go back and think about the lessons I learned, one of them is don't just sit still in a room and talk about stuff. I mean, because that's ineffective. You have to do stuff to get kids active. And I'm not saying that teaching in a room is bad. I'm not saying that. I know you guys have to do that. But so today I'm going to try to talk about autism as it relates to being in the classroom. And if you don't think you've ever had a student with autism, then you just didn't know it, because there are a lot of them. And I will quote some research for you in a few slides, but I'm not going to sit here and read all these things to you directly, because you can do that on your own. But what you need to know is we used to blame parents for autism, especially mothers. We used to say it was poor mothering that caused autism. And obviously, we know now that is not true, and it was quite harmful to the mothers, I'm sure. And then we started finding research about genetics and things like that, and we found that old ovaries can cause autism. So we blame moms again for that. And then more recently, probably within the last 10 years, we found that old sperm can do the same thing. So now we can blame dads too. But some of it does have to do with the age of the ovary, age of the sperm. And there are a lot of other factors, like what were those people exposed to in the time that they were developing? Were they exposed to aluminum dust? Were they exposed to radiation? Were they exposed to, because all those things have a great influence on development of autism in the womb. And in fact, they're finding now that a lot of people, this is offside, people that worked in facilities that manufactured airplane parts, like my grandmother did, developed Parkinson's disease and Alzheimer's disease from the aluminum dust. So I'm sure it can have other effects on people who are trying to conceive a child. So everyone now is, fairly familiar with the idea that it can't be passed on genetically, or it can be passed down through families. But it's quite odd, because autism itself, what's called regular autism or classic autism, is not one-to-one transmission. You can have a family that doesn't have an autistic child for a long time, but the one that is passed frequently is called Asperger's disorder. You're probably familiar with that. You've heard it a lot, but it is a very male condition. 90% of people who have it or above are men and boys. And the problem is that when we try to identify in girls, they often don't look like the boys do. They don't have the same kind of traits. They tend to be more emotionally unstable, and they have a lot of behaviors that get labeled as other things like bipolar disorder or things like that. So I have been working with kids with Asperger's disorder for probably 15 or 20 years. And when I was very angry when they eliminated the diagnosis from the diagnostic manual for mental disorders, but the families that work with kids, who have kids, who work with kids, they still see Asperger's disorder as a viable diagnosis, and in fact, the World Health Organization still has that on their terminology. So just because we in our arrogance try to drop something doesn't mean that it's going to go away. Go ahead. So I don't know if you know this, but in the world of psychiatry, the psychiatrists are the ones that developed a psychiatric manual. It's called the DSM-5, the Diagnostic and Statistical Manual for Mental Disorders. They're the ones that dropped the Asperger's diagnosis, and they came up with one called Autism Spectrum Disorder, which means everything. All those diagnoses that are listed right there used to exist in and of themselves, but now it's all lumped under Autism Spectrum Disorder, and the acronym is ASD. So briefly, I'll just tell you what some of these other things were. Pervasive developmental disorder was a condition where you didn't meet full criteria for autism. You might have had 2 of the 3 things that you needed, or 1 of the 3 things you needed, but you didn't have all 3 of the things that you needed. And I'll tell you what those 3 things are in a few minutes. Rest disorder was probably exclusively a female disorder. It typically involved intellectual delays, lots of other physical problems. And they've actually taken that out, and now it's more of a genetic neurological condition and not necessarily considered an autism spectrum disorder. And then this is, to me, the most fascinating, childhood disintegrator disorder, which no longer exists technically, but it is very odd because it happens that at the age of 2 years, the child develops normally until 2 years, and then all of a sudden the skills disappear. So you have a child that talked normally, walked normally, was near potty training, and then all of a sudden is no longer potty trained, doesn't talk anymore, and is unable to function motorically like other children. So you're thinking, like, what is that? Like, surely there's got to be some kind of biological explanation, or some kind of inheritance factor. So I believe that this is where the myth came from that vaccines cause autism. Because at the age of 2 years is when you get the vaccines. There's 4, and you get, I think at one point, 2 in each leg or 3 in each leg. There's quite a few vaccines, and then the Georgia Academy of Pediatrics got together and said, we're going to take out all mercury in the vaccines to make sure that it's not, the case, because we found that mercury can cause anomalies in development. But then that still didn't change anything. So, and this technically still exists because I still see, every year I'll see 2 or 3 kids who develop normally until about 18 months to 24 months, and then the skills disappear. So I have no explanation for that. No one else does either, even though the vaccines are supposedly now totally safe. It can't be the vaccines, because some of those kids aren't even getting vaccines anymore. And I don't know if you know about that, but that's a big thing in the autistic community too, because the vaccines, kids aren't getting vaccines, so now we have a rise in measles and mumps and things like that. So I am a proponent of vaccines. So this is where I explain to you what autism is, the current diagnosis. You have to have significant communication weaknesses, which means either verbal behaviors or nonverbal behaviors. So that doesn't mean that you don't know how to talk. The majority of children with autism talk and talk extremely well. But the verbal problems come in where I want to have a conversation with you. It's not reciprocal conversation. It's my talking to you and you shutting up. You're not going to say anything. Or it's you're saying something to me and I don't know how to answer your question. I don't really know what you're trying to ask me, even though the person can tell you what the words are and repeat the language back to you, they may not be able to tell you what an answer is. Nonverbal aspects of communication is anything from emotional expression to body language to eye contact, things like that. So those are the kinds of things we look at in that area. So my groups, the groups that I have for social skills, focus heavily on these kinds of things. Obviously, we also focus on socialization weaknesses, but again, to me, those ultimately stem from communication problems and other things of that nature. I will tell you that when you're thinking of kids on the autism spectrum, I see a lot of kids and I'll diagnose them with an autism spectrum disorder, and they'll go to school or they'll go to church or whatever, and somebody at the church or school will say, that kid does not have autism, there's no way. Well, I did spend a lot of time with this person, and I did try really hard to rule out other things. But you have to understand that all the things that are described as problematic for kids with autism are on a spectrum too. It's not just the autism is on a spectrum. It's all the behaviors are on a spectrum. So like kids typically with autism get identified as not liking socialization or not wanting to be around other people. That is not true. That is not the majority of kids that I work with. They really like being around people, but people annoy them, or people are so abrasive, or people have been so negative to them that they sort of shy away from it over time. And in fact, I have some kids that I work with who do avoid contact, but there are some who are so intrusive. They lack boundaries. They will get up in your face. They will touch you. They'll mess with your stuff. That is the opposite. So again, that's a continuum of behaviors. And if you guys have any questions at any point, feel free to ask, because I love just talking. That goes back to the bottom thing I was talking about later. Another one that I focus on heavily in the groups that I have, and I have groups for preteens, teenagers, adults, young adults. Unwritten rules. There are a boatload of unwritten rules. I mean, they're everywhere. But we assume that everybody knows what they are. When you go into a library for the first time, everybody assumes that everybody knows you're supposed to be quiet. Well, why is that? I mean, I don't see anywhere up here. Hopefully there's one over there. But unless I walk right over that door. And the reason this is one of my pet peeves is because I used to work at the Washington Memorial Library, and I was always like, that kid's not being quiet. What is wrong with him? You know, he doesn't know what he's doing. But now I've come to realize that not everybody knows these rules. And they're all over the place. Like, you're not supposed to stick your hand in your mouth when you're at a McDonald's. Why is that? Nobody wrote that down anywhere. So, we spend a lot of time on unwritten rules, and especially as they relate to making friends, keeping friends, things like that. You're not supposed to call your friend a specific name or use vulgar language in their direction because they might not want to be a friend anymore. Well, who wrote that down? Where is that written? I'm sure there's got to be a book somewhere. So the second part is socialization weaknesses, and then the third part is stereotype, circumscribed, or repetitive behaviors, which is a fancy term for anything that's in excess, a behavior that is often annoying to other people, interferes with things. So an example would be, I used to have a kid that I worked with who loved the Titanic, but he only liked watching the part where the boat sank. So he watched it over and over again. His parents were so sick of that scene. They were just, Dr. Johnson, can you please get him to stop watching that? We are sick of that. It's in the car. It's in the, it's on this portable DVD player. Other things could include, things that are obviously associated with autism, like when kids do this, or they hand flap, or they jump up and down, they get really excited. But that is not the majority of kids. They don't do obvious things like that. And another one of my pet peeves is kids with autism often get diagnosed with obsessive compulsive disorder. Well, if you have this in the diagnosis of autism, you don't need that extra diagnosis. It's already here. So if I like to touch things and I just repeatedly go to every desk and I have to touch it before I leave the room, I'll touch every desk before I leave. That's still part of having autism. It's not obsessive compulsive disorder. What I include here, I know not saying appropriate things or whatever is sort of a social rule, but in a way, repetitive behaviors are in this area too. When you have a child that makes repetitive, inappropriate statements, like, I'm just going to point out everything about you that's negative, and I can't help myself. I'm just going to say everything. You wear glasses, you have gray hair, I'm just going to keep going down the list. I had a kid who couldn't stop himself from doing that. His catchphrase was, no offense, but. And I said, look, it is so easy for you to eliminate that behavior. Let's just get rid of those words, and then you won't. But he did it for a year. He just would not. He was in one of my groups, no offense, but you're really fat. Or no offense, but that dress smells. And I'm like, okay, we're going to have a rule where you're not allowed to talk at certain points. And if you start raising your finger, I know you're going to say those words again, so you just stop right there. And so eventually we did get him to stop. He's not happy about it. It gave him some satisfaction to express himself and be honest, because I don't know if you know much about kids with Asperger's disorder, but they tend to be brutally honest about other people. Not themselves necessarily, but they're good at pointing out things about other people. So now what you have is a diagnosis of autism spectrum disorder, and you actually have to rank it according to whether you need support, substantial support, or a very substantial support. That's very subjective. There are some criteria in the book for doing that, but the majority of people that you're ever going to see are going to fall in this lighter, milder end, if they qualify for a diagnosis at all, because it's much harder to get an autism diagnosis than it used to be. So I'm going to try to hurry this up so I don't run out of time so I can talk about the actual beneficial aspects of this. I took this off the internet. It's a National Survey of Children's Health, and they found those factors are critically important in determining whether there's a risk factor for a mental health condition, which oddly enough also includes autism. But parental mental health has a lot to do with it, and so does a stable family home base for their medical care, which also probably speaks to whether they're actually getting medical care or not. So, and I don't know what to tell you about the statistics because they change it every other week. It was 1 in 63, 1 in 86, 1 in 72. I mean, it's somewhere in the teens, but not actually 100. But and I don't necessarily believe these statistics. I mean, I see a lot of kids, and I wouldn't say that this is a great number to quote, but I will say that it is 1 in 37 boys. That's actually fairly accurate, and that's because of Asperger's disorder, in my impression. Asperger's disorder is extremely common. A lot of kids get diagnosed with it, but autism is much rarer in girls. And going back to the genetics thing, one of the things that you can also see in studies is you have twin studies, and one twin will have autism and one won't. Or you'll have a family with triplets, and one will have it, or two will have it, and another one doesn't. So it can't be just an explanation of genetics. Even if it's identical twins, sometimes if not, both of them don't have it. So I already covered that one. It's the wrong way. Yes. So I get asked often, what do you think explains the increased prevalence of autism in the general population? I really don't think there is an increased prevalence unless you look at all the toxins and things that we're exposed to in our environment. Studies show that, like I said, lead and a couple other things are associated with a greater propensity for developmental disorders. But this is the number one thing, the number one reason I think it goes up. Because what happened was Asperger's disorder, I will say it came about from a Nazi. His name was Hans Asperger. He was actually, in the Nazi party. But he had an orphanage, and he found traits of kids that were similar. They had very oppositional behaviors. They were rigid. And so what he did was he just labeled them as that. He gave them a sort of I don't even remember what the term was. But then later on, it became associated with him, but people dropped it, and it was gone for 54 years until 1994, when the earlier version of the diagnostic manual came out, and they reinstituted Asperger's disorder. And now they've gotten rid of it again. I don't know why. So when Asperger's disorder came out, it was much easier to diagnose because now you had an explanation for kids who were labeled oppositional defiant disorder and all these other things, and they had diagnoses that were that long. They had multiple diagnoses, and now you didn't need all those things anymore. Now you can just say, look, they have Asperger's disorder. This explains so much. So, okay. The reason I put these pictures up here is just to help you realize that children with autism, Asperger's disorder look no different than any other kid. I mean, if they were walking down the street, unless they had some stereotypical behaviors, you wouldn't even know that they have autism. Okay, so I try to tailor this presentation to you guys because if I did it for a public school, I would be talking a lot about IEPs or things like that. You guys don't have that, but you will see a lot of kids who have autism or Asperger's disorder. So I think the kids that will come to see you are going to be in the high-functioning autistic range. And the other thing is, people think kids with autism are the ones that are running around flapping their hands, making odd noises, things like that. That is the small majority of kids with autism. It's actually less than 20% of kids with autism actually do those things or are intellectually impaired or have language impairments. The majority of kids actually are average to above average intelligence. They just have socialization, language weaknesses, and other behaviors that are problematic. So these are the most common reasons that kids are referred to our clinic for an evaluation. What's odd is I get a lot of kids who refer for academic problems. But then when I do the initial consultation, and I'll see that, wait, this goes way beyond academic problems. This is like, the kid may be in the session and they're not looking at me, they're not maintaining eye contact, they're just going through my drawers, and I said, Mom, does he do this all the time? And she's like, oh yeah, he likes it. He's very friendly. I'm like, that's not what I would call it. Defiance and poor rule following. And if you know anything about Asperger's disorder, you'll know that kids with Asperger's disorder are good rule followers when it's their rules, not yours. They don't care about your rules. Sometimes they, adapt your rules or take in your rules, but they don't necessarily like them. Making inappropriate statements aloud. This is a frequent referral because I'll have kids in class who have Asperger's disorder who like to blurt out curse words or like to say things that just, like I said before, off the top of their head. You're fat. You're ugly. You wear glasses. You got pimples. It's not always that obvious, but it may be mumbling things under their breath. I have one kid that mumbles all the time, and I said, what'd you say? Nothing. You said something, you mumbled it. I know you did, and you wanted me to hear it, but you won't come out and say it, so you're scared, right? And so usually if I do like that, they'll start telling me what it is because they don't want to be perceived as scared. Anxiety or anxious coping. If you know anything about Asperger's disorder or autism, you'll know that kids with those conditions struggle much more than most people, and every day is a laborious task. Every day is hard because you're asking me to do stuff, you don't do what I want you to do. 15 people are asking me to do things that I don't want to do. Why is that? Why do I always have to do stuff that other people want? It sounds facetious, but it's not. I mean, really, a lot of times they don't understand why they're being asked to do all these things. I'll just do it because I don't want to be yelled at, but why are you asking me to do math homework? I don't really know why. And I'll explain to you why that is later. Poor social skills, this is actually one of the lower reasons. I don't frequently get referred kids because they have poor social skills. Because oftentimes that will slide through. People don't really care about that as much. I mean, especially parents, well, maybe if she's avoiding other people, maybe they're not going to have any problems. Maybe they're not going to get in trouble. They're not going to get into high school and they're not going to do drugs or drink or whatever. If they don't have any friends, you think I'm kidding? I'm not. I actually thought that myself. How could I make my kids less popular? And school refusal is a big one. And actually, it starts much earlier than you guys will probably see. But school refusal would, they're asking me to do all these things I don't want to do. They're asking me to go in that door where all those things are, and I'm not doing it. I know I'm not. I'll pitch a fit. I'll throw things. I'll attack whoever I need to attack. But school refusal is a big one, and a lot of that stems from the anxiety that they experience on a day-to-day basis. So this is a conundrum for parents because I see the parents and they're describing to me children who are extremely aggressive, who are verbally abusive, saying the vilest things, but at school, they're not doing anything. They're not getting in trouble. They may not be performing, at their best, but they're not doing a whole lot at school, and that is because they don't want to be perceived as different, or they don't want to get in trouble, or they will let it fly when they get home with their parents. So especially on the drive home is a big problem. So So a lot of times what I'll do with parents is I'll say, why don't you get something to de-stress them in the car, get a sensory bag, or get their favorite movie, or have them tell jokes, whatever it takes just to calm back down on the ride home. But the majority of times what happens is they get in the car with a sibling who knows what their buttons are, I press A, B, and C, and they were off. People with Asperger's or autism, typically, and obviously the statements I'm making are generalizations, they don't apply to everybody, but they are not good at asking for help. They despise asking for help because that makes me look different, it makes me anxious, I have to talk to somebody, they may say no, and that would be horrible if they said no, so I just won't do it. And so I've seen a lot of IEPs or 504 accommodation plans where they write the specific accommodations in there, and it'll say, Johnny has to come up to teacher and say these things. Well, I can tell you right now, that's never going to happen. So you might as well take that out of the 504, but it's not going to happen. Even if we offer a pack of Pokemon cards right afterwards, it's not going to happen. So the reason I mention Pokemon cards is I can get anybody to do anything with Pokemon cards. So here's my own conundrum. I often advocate on behalf of people who have Asperger's and autism, but I will tell you they can be as manipulative as anybody else. If anybody tells you that that's not true and it's because of their developmental condition, they're lying. I mean, everybody can be manipulative. I have people with IQs of 50 who can be manipulative and defiant. I mean, so it's not just because they have autism after disorder that they can't. Of course they can. But there are two things that create more problems for people on the spectrum than any other, and that is poor flexibility. And you've heard the stories before about, Johnny insists that we go home every day the same way. We can't deviate the route. If we do, you'll have a fit. That's just an extreme example. It's more of a common example, but it can include anything from the best example I have, the one that still makes me get upset is there was a kid in a private school in another county somewhere, and his grandmother, before she dropped him off, said, "Stay in the classroom, I will come and get you." Later on in the day, she was going to come pick him up. So it was in the end of the day. I think they were maybe cutting out like 5 minutes early. And he was told to leave, and he wouldn't. He just didn't respond to the teacher. He just sat there. So the teacher got angry and got up to him and said, "I need to leave. I've got somewhere I got to go." Was incensed that he was just ignoring her. She thought it was a defiance thing. Then she got security to come get him, escort him out. Then he pitched a fit. He kicked some security guard. The security guard fell on his head, had bleeding, and he would not say why he was staying in the classroom, but he was very upset that he was no longer in the classroom because the security escorted him out until Grandma showed up and said, "I told him to stay in your classroom." So that's where the inflexibility and problem with that can come from. The other thing that you may or may not have heard of before, it's called theory of mind. A lot of people with autism, of course not everybody, think that you think the same thing that they think. So when you say something that's contrary to what they believe, they don't know what you're doing. Why would you say that? You know how important that is for me. Why would you say that it's not? Why do you say I can't have it? So that's where a lot of behavior problems come from. That's where a lot of defiance comes from, because they're not defying you just because they can. They're defying you because they don't know why you're saying that. It's almost like I was going to put a picture of the Borg ship. But if anybody knows anything about Star Trek, the Borg is a group of it's an alien race that takes in stuff, but it doesn't change their world or change them. They just latch it onto them. Like, here's another piece I'm going to stick on me. Here's another piece I'm going to stick on me from it. So they consume other races, but they don't change themselves at all. That's extremely similar to what people with Asperger's and autism do. They don't change their beliefs because of what you said. They might stick it right here, and they might be able to recall it at some time. Like, I know you said that I'm not supposed to throw spitballs across a room, but I really like doing that. And so I'm going to keep doing that, even though I know your information is right here. I won't forget it, I promise. And a lot of times, that's another thing that I see parents, I'll do like a family portion to therapy or whatever, and parents will say, I know he knows this stuff. He can tell me right back what what it's supposed to be doing. That does not equal application. That's not the same thing. I might have that information up here, but that doesn't mean I'm going to do any of it. Okay. So common triggers. Has anybody ever here worked with students who have autism? Well, this is not like I'm not trying to call you out, but like have you ever had any specialized training or anything, or anybody? Okay, so I'm talking to everybody else then. People with autism Asperger's disorder have lots of sensory issues, and I'm sure you've heard about that before. But just think about your five senses. All those things are constantly being bombarded and overloaded. So you can't turn it off. And it gets worse in settings where you can't control it. So like if I'm in my room and I'm blaring rap or heavy metal, that's fine. It can be on 11 and it's still good. But if my brother next door, his is loud, now if I can hear it in my room, that's going to be a problem. Because I have no control over that, and it just incenses me. I can't stop it from coming in. So a lot of times, kids with autism Asperger's disorder despise singing. They hate singing. Not everybody, of course. But, okay, so let's say car ride home, mom turns on the radio, 95.1 or whatever. They start singing to it. There's a fit in the back. Stuff gets thrown to the front of the car. What's wrong with you? Stop singing. So it's an extremely common scenario. That's why I bring it up. Bells, that's not true for a lot of kids on the spectrum, but it is true for some. So they are extremely bothered by fire bells, things like that. One of the common remedies for that, and especially in a public school, would be to write into a 504 plan. If you know there's a fire bell coming, you just say, child needs to go into, a sound sequestered room where he gets to wear headphones or something like that. So you may not ever see kids who have that severe, hearing issues, but another thing is, speaking of sensory issues, is touch and pain tolerance. A lot of people with Asperger's disorder autism have an extremely high pain tolerance. I mean, they can break their legs and they can continue to walk, and it can turn blue and purple, and the parents are like, what is wrong with you? And they'll look like, oh my God, what is that? What happened? Well, I fell out of a tree and my leg went that way. And so that's an extreme, but I have kids who, I don't know if you know, like stimulant medications, like ADHD medicines will increase the propensity for you to bite your fingernails or bite the skin of your, whatever that's called, the quick or whatever. I have some kids who will do that until they bleed. Like they literally have blood pouring out and they still do it. Kids with autism, they don't feel that. I mean, it's, why don't you stop? Shouldn't that hurt? No, I mean, it doesn't hurt me. Even such inane things as having to change subjects or change classes can cause problems too. So change in and of itself is usually not friendly to the person that has autism spectrum disorder. Now, here's my number one pet peeve. And you guys are probably not going to like me for this. People with Asperger's disorder despise writing. Absolutely will fight you not to write. And it doesn't matter how good or bad they are as a writer. It doesn't matter. The functional aspect of it does not relate to that. For some reason, they have a biological block about writing. And I mean, my wife Valerie actually worked in another private school a whole year trying to get a kid to write one sentence a day in his journal. And it was a fight every time. It took an hour or two to get him to write one sentence, even in 3rd, 4th, 5th grade, when he should easily be able to do that. But if you got him a laptop or an iPad or asked him to say the sentence, no problem. But if he had to physically take a pencil or pen and put it down on a piece of paper, you're off to the races. You're going to have problems. So one of the easiest accommodations in school is to not ask them to write anything, but again, that's why you guys are not going to like it. Using a laptop or iPad is one way to get around that. And the reason I like to bring it up is because it's so easy to eliminate problems, because teachers are like, I don't know why he's always coming to my class. I have English and creative writing. I don't know why he all hates me so much.
So is it handwriting with handwriting?
It's not a handwriting problem.
So keyboarding is acceptable?
Yes. because it's a computer thing. I love computers. Most everybody with Asperger's disorder loves computers. Hate pencils. Unless they're mechanical pencils, now that's okay. I don't know what that's about either. I can't explain it. But even then, they don't want to use them to write. They just like to hear them click. Group participation is another big problem. But actually, I have a couple slides that I talk about that in a little bit more detail. Not knowing how to apply provided knowledge. So, again, this goes back to, I can tell you up and down what I'm supposed to do in class, but that does not mean I'm going to do it. It does not mean it's going to influence my behavior. I just know it, and I can repeat it back to you verbatim. And most people will think that's defiance. You just refuse to do it. It's not. Not for a child on the spectrum. And then there's obvious other things. Oh, the unstructured time is another one. So, I don't know, you guys don't have flex time anymore or something, I don't know, but you used to have this thing called flex time. That is an unstructured time, right? I mean, that's where you're supposed to be doing your stuff at your own house, like a study hall. That is a big problem for most people with Asperger's or autism. They despise those times. What's weird is I have a lot of kids in public school who will act out just so they can go to ISS. So they can organize their own day. I can get all my work done, and then I can color, and I can draw, and I can avoid all those fools in the other classes. All right, public school students with ASD are often provided a 504 plan. I'm sure you're all familiar with that. I just wrote down some of the more common things that are allowed on a accommodation plan, and a lot of these you can actually get into college as long as you have documentation along the way that you're in need of that. So again, here's the one that we use to address the writing problems. Allow use of a computer tablet. You know, in college you can record the lectures, or you can have another person do the notes for you, and you can get the notes from them. You can, the learning centers all provide notes, so there's lots of ways around the writing issues. Okay, so just remember this, it's in there. If you ever wanted to look at it, you can do it. I'm not going to go over it in detail unless you have questions about it. Okay, so teaching and related considerations. This is a very individualistic kind of thing. Nobody with Asperger's disorder has the same kind of learning style, same kind of learning needs. So the stuff that I put out here, it's not going to apply to everybody, obviously, but a lot of these things, there may be one of these things or none of these things that apply to a given person with Asperger's or autism. So just so that you know that just because I put them on here does not mean that they apply to whoever you name in your mind. Okay, so anything in written or visual format would be great to aid learning. So here's an instance where you can think about it this way. I might know how to tell you what you said verbatim, does not govern my actions, but if I can see it and it's in front of me and it's written down somewhere, it's much more likely to influence me than it is if it's up here in my head, locked in my secret cave, or wherever it is. Another thing is clear step-by-step rules. You might assume that the person is extremely smart, and maybe they do have 130 or 40 IQ. I mean, a lot of the kids that I assess do have those immense IQs, but that does not mean they don't need clear, step-by-step written guidelines on a piece of paper or on a computer program or whatever, posted in front of the classroom. They have to have those things, and they benefit from them intensely. I mean, in the groups that I have, I don't have many rules, but I put them up on a big poster board, and they're there. And if I see somebody's acting up, I'll say, "Look, what's number one?" "Oh, okay. I shouldn't be saying that." Even though, I would assume that because they're very intelligent, they would stop themselves, but they do much better when they have something clear in front of them. So this may seem odd because everybody is about choice and making sure that everybody has personal choice about things. You do want to give choice, but you want to limit them to 2. Not 3, not 4, just 2. 1 or 2. Is it Coke or Sprite? Not a Fanta, no Mellow Yellow, Coke or Sprite. And the best example of this, I have groups that we eat snacks together, and I'll come up with 2 choices. Do you have Dr. Pepper? October spring. Melio, nope. So now they know. They don't even ask me anymore. They'll say either red or green. That's how we do it. And I was talking to Carrie about this earlier. There's a lot of schools that have tried desensitizing zones or sensory soothing zones or rooms that are just designed to help you calm down. It's not like a seclusion room or like in the old days a padded room. It's not like that. It is a room where there's the colors on the wall are soothing. There might be some mood music in there. They might have some beanbag chairs or that kind of thing. I don't know. I mean, the one in Houston County at Hoco, they even have lava lamps, and I don't know that they need to go that far, but they do work. Now, here's the problem. Here's the trick I was talking to Carrie about. Okay, so if you like that place, you're gonna go. You're gonna do whatever you need to go to that place, and you can say, "Well, Coach, I tell you, I have to go there. It's written in my IEP." Well, why are you going there now? Well, I don't really want to take this test right now. I want to go to my soothing place. So you have to watch out for that because it can result in escape behaviors. And I'm sure you guys already do these things for motor strengths or special skills. The way that I do it in the groups that I have is a lot of kids have extremely, like there's one kid in the group who's phenomenal with calendars, dates, or whatever. So whenever I tell him a date, I might come back 2 weeks later and say, what day are we going to the movies? Oh, it's on September 13th at 4 o'clock at, so-and-so movie theater. I'm like, okay, now you guys all know. He just told you what it was. If you have any questions, just call him or ask him on the way out. So. Some of these things I threw up here just because they were things I was thinking about at the time, so they don't seem organized in some way. It resembles organization in my mind. So here's another thing that I often put in an evaluation. There's a concept, obviously, about generalization and having a behavior that doesn't generalize, but there's also something called state-dependent learning, which is if mom teaches me the state capitals with flashcards at night in a special room with certain lighting and we're listening to, Barry Manilow, I don't know, whatever. If those are the conditions under which I've learned, those are the conditions that govern my ability to recall that information. So the next day, when you give me a test, I have no idea what that's for. But then mom's like, what, are you crazy? We studied this like 3 hours. You should know the state capitals by now. I can't recall it because you're not there. It's not in my house. There's no Barry Manilow. It's not soothing lighting. And there's no flashcards. So that does not mean that you have to teach to the way you taught the skill, but just realize that a lot of times kids are not making this up. They cannot recall the information because they learned it in one way and they cannot generalize it. It is stuck in that one way. So if I teach you a coping skill about how to manage your anxiety and I only teach you one way, that's the only way you got. So a different scenario presents itself, I don't know how to adapt. I don't know how to change that. So in a lot of the groups that I have, we spend a lot of time doing novel things or different activities so that you can learn to adapt. And I don't know if you've ever had a student of mine that was in a group, but if they tell you that I am extremely sarcastic and say a lot of things like that in group, it is true. I do a lot of that. I do it all the time. I say really wild, crazy things in group just to see if they can read that I'm actually not being serious, or if they take everything that I say, like if I say, one of the common ones, I would never do this in group, but if I look at you and say I'm going to kill you, would you take me seriously? And I don't use that in group, but I'm just using that as an extreme example. If they're going to go to the bathroom and I say, you got to give me $5 first. And if they look at me like, what? I don't have $5. Then I can know, well, I'm being effective or not effective because they still have trouble reading through sarcasm and things like that. So spend a lot of time with that. And then parents get caught up in it too because they want to do it when they go home. They'll be doing it in the car like, I think I just want to rob a bank today. I'm really hungry and I don't have any money. Just want to go rob a bank. And the mom's like, what? Did you get that from Dr. John's? Like, no. Another thing that you should probably be familiar with is kids with autism and Asperger's disorder are incredibly at risk for being bullied. And it's because they have so many triggers, and they wear them on their sleeves, or where their hearts are on the outside. So people find out about this over time. They know if I say a certain word, if I sing a song, or if I make reference to Yu-Gi-Oh! And I'm a Pokemon person, I'm going to get mad. I'm fixing to go off, and I have no ability to stop myself. So that is something that I work with a lot, but just realize that kids with Asperger's and autism, just like I guess with other kids, they're not going to come and tell you that so-and-so's bullying me, or they're teasing me, or they're making fun of me. Sometimes I might not even know it. There is a lot of social naivety that goes on. And so, like with some of the students that I work with, I'll ask, what happened with, Tanisha today at school? And they'll say, oh, this and that and that. I go, what did you think about that? Like, well, she just didn't want to be friends that day. Well, from what she did, it sounds like she didn't want to be friends at all. That was really horrible. Well, it wasn't that bad. Well, I'm thinking that like when she posted your name on YouTube or on Instagram, and she did all these other things, yeah, she doesn't want to be friends with you anymore. There's something there. No, I think she still wants to be friends. So, and there's a lot of wishful thinking that goes on when we start talking about friendships and relationships. But I do a lot of teaching around. Let's look at this. Is this what other friends do to each other? Do they post things about each other, or do they make do they ride by and yell things out the window when you're outside playing in the yard? No, they don't do that. So I know this is real wordy. I didn't really have a chance to break this down, but the number one thing, I guess, from a diagnostic perspective is, do parents want this information out, or do they not want it out? A lot of times, well, it's not, I guess it's like 50-50. Sometimes they don't want it out. Sometimes they do want it out. To me, the parents that want it out, they're the ones that are thinking more clearly and more soundly, because they know that at some point this is going to benefit their child to have a track record, especially with the schools, that says my child has an autism spectrum disorder. They require some accommodations in middle school, high school, and now they need those same accommodations in college. It's not like you're trying to get a handout or anything like that, but you do want a track record. The parents who sort of keep it secret and don't want to tell their kids, don't want to handicap their kids, I understand that their reasoning for that, but a lot of times it's a false fear, I guess. Not everybody's going to run around and say, hey, Jim has autism, he's so funny, they're not going to make fun of you just because the staff know what the autism diagnosis is or whatever. That's not what happens. So. And I'm sure you would never hold it against the child because they have an autism spectrum disorder diagnosis. So sometimes I really don't understand where the fear comes from about sharing a diagnosis. Because again, I know like within a lot of other schools, the information that you have is protected. It's not like you're going to go talk about it in class and hold this. Look, this is a report that Jim had done about him, and here's what it says. So parents are the gatekeepers of the information, and sometimes they worry needlessly. So one good thing that you can do in the classroom is, for instance, if you have a student who doesn't clearly know what they're supposed to be doing, just tell them to look around and see what the other students are doing. Now, there's obviously a problem with that. If they're not doing what they're supposed to be doing, and they're doing something bad, of course. And I do this a lot. Especially if we do practices like role plays or whatever, I'll say, just watch Jim and see what he's doing, and then you can just copy him. And because a lot of times what I'll tell kids where the behavior doesn't come naturally, or where there's just seem to flow or click, I'll say, this is just like acting. Just pretend like you're an actor, and you don't have to like these people. I want you to learn to pretend to like these people. So you're going to learn to be an actor, and we're going to pretend to have good social skills, and we're going to pretend to like people. Because sometimes kids will say, I don't want to get close to anybody, and then sometimes that's because they've been hurt a lot. But so I'll just tell them to pretend. Show or model how to react to a student with this. So this, I should clarify this a little bit. This speaks to if there's a diagnosis that's open, and if everybody sort of just generally knows that the person has an autism spectrum disorder diagnosis, tell the people that are sitting next to whoever what to do if whoever just decides to throw their pen in there and throw their books across the room. What should I do? Should I run? Should I go out of the room? What should I do? So you might want to give a little bit of lesson about, like, if Jim does this, this is what you should do, and model it. And this refers to the model behavior for the student with autism. So if you want them to do something very specific, show them exactly what you want them to do. So if you want them to, if they're really upset, go sit down in their chair and put their hands in their laps. Not likely going to happen. But if you want them to do that, then show them how to do it. Physically act it out in front of them. Teach alternatives. The trick for most people with an ASD is they have a hard time coming up with any explanation other than their own, is what I was talking about earlier about the Borg and things like that. They cannot entertain alternatives. So for you to come up with another explanation why Tiffany, said that mean thing to you, why would she say that? Maybe she was having a bad day. Maybe she's just not a mean person. Maybe there's other things going on in her life that prompted her to say those things. But explanation number one, which is she's just a mean, bad person. It's going to make me hate her and I want to go do stuff to her. The other ones might not make you be so upset and might make you be more tolerant of Tiffany next time she has an issue or she says something that's hurtful. This is another thing. You can't assume that just because Mrs. Alderman said, hey, you can go to Mr. Bartlett and just talk and just hang out and he'll be okay and he'll calm you down. Just because you said that does not mean that person is able to do those things. You have to maybe escort them down in Mr. Bartlett's office and say, here, look, come sit down in Mr. Bartlett's office and he might talk to you. Look, he's making eye contact. He probably does want to talk to you. That you have to actually go another step because, just providing the information again does not assume compliance or ability to do that. This is another one it's hard to tell schools to do, but it works incredibly well. It's a buddy system. So it works all the way from elementary school through high school, but identifying one or two people that the person with autism can go to that's not an adult, that they can say, what am I supposed to do for tomorrow? Or, she just said something to me that I thought was really offensive and I think I want to hurt her. What should I do? It's a lot better coming from another peer and a lot faster than, and hopefully they'll say the right thing. You shouldn't hurt her. You should probably just move over here and forget that she said that. But buddy systems work incredibly well because those are the people that you can say, hey, look, your buddy over there is taking the test too. What do you think he's doing? Is he talking? Is he filling with stuff? He's doing what he should be doing. So watch him and do the same thing he's doing. It works incredibly well. But again, how many kids do you have that want to volunteer to be a buddy? I mean, that's hard. What payoff are you going to get? It's morally great. It's a great thing, but nobody's going to give you money for doing it. And there are some kids who want to do it, but it's like you go around the classroom recruiting kids like, hey, you want to be a buddy? Well, not really. Provide increased supervision during unstructured times. That's easy for me to say and harder for you to do, but what you have to understand is a lot of times problems do arise in unstructured times if they are study halls or places where students can just hang out and frolic or whatever. Sometimes that turns out bad for the students who have autism spectrum disorder because they're going to either get picked on or they're going to do stuff that gets them in trouble because they, just like everybody else, like to be entertained. Like the kid you're telling me about that saw a hole and tried to plug it up. I mean, that makes sense to me. Not necessarily, from an administrative standpoint. You don't want holes, just random holes around. I mean, there's a reason for those things. You've got to plug them up. And I'm being, sarcastic, but you have to understand that a lot of times the logic that kids with ASD apply is logic. There is a reason for what they did. You may not understand it or even appreciate it, but they have a reason for what they did. Allow solitary activity. We on a different slide?
We didn't change it.
Allow for solitary activities to go to a less stressful place. That's what I was referring to earlier about the stress-free rooms or whatever. But it doesn't have to be a stress-free room. It can be, go sit in the quad. Be very specific. Go sit in the quad. And this part of the quad, within 50 feet of this area, you probably do have to identify that because otherwise it might be all over the quad, and the quad might stretch out into the street. And then this is the one. Think it, don't say it. This is the one I was talking to you earlier about, the kid who had the, no offense, but he was very resistant to these strategies, but I did get him to stop doing that over time. So, group work. Why is group work so difficult for kids with autism? It's been, these are just fancy terms for the group. People in the group don't do what I want them to do. They are going to be close to me and they're going to want to touch me, or they're going to touch me and I don't want them to touch me, or they're going to have their books spread out and this is my space right here, don't get in my space. Or, it can be any or all of those things. They're going to be talking and I don't want them talking. They're going to be looking at me and I don't want them looking at me. And those are extremes, but those are very often the explanations I hear from the students I work with. So a lot of that has to go back to sensory overload, physical closeness, lack of control or predictability. I know some intensely brilliant individuals who have a really hard time with group because they know at some point they have to relinquish control to another group member, and I don't want that. Because they're not going to do it right, and they're not going to do their work, and they're not going to do it when I want them to do it. They have to turn an interview by Tuesday. And so I have to do my part, and they're just not going to do it. And I'm just not going to be satisfied with it. It almost sounds like a teacher. I'm not going to be satisfied with their work. So here are some things that you can do to ease the potential problems. Now, don't spring the group on anybody with autism spectrum disorders. That's just not going to work out well ever. So you might want to have it on a syllabus or give some pre-warning, maybe a week or two in advance. It would be good if you could keep them as small as possible. I don't know how big your groups typically are, maybe 4 or 5 students at most. That seems pretty manageable. But I have kids who go to other schools where they might be a group of 10, and that is not going to turn out well typically. If you could put the person with autism in a group where they know people, even if, maybe not their best friend, but at least they know the person, it might help to quell some problems. Provide warm-up activities. That's quite difficult, but it's just like you do with any other kind of setup where you want people to engage in cooperative activities. You want to be sort of like an icebreaker. Hey, let's come up with 3 things that you want to do over the summer, or maybe one thing over the summer is play video games. I don't know. Provide written rules and expectations along with what to do when problems or conflicts occur. So, I know it may seem common. You've already said in class what they're supposed to do, but that's not going to help. You have to have written rules and expectations. Even if it is simplistic and the rules are written down on a big piece of, cardboard or poster board, they have to be written down, because then I can refer to them when so-and-so doesn't do what I want them to do. When they don't, I can look up there and say, look, number 3, you're not doing it. And the conflict part is important too, because and that can include anything, but it might make the person feel better and feel like they're being listened to if they know that I can go to you when rule 1 through 5 are not followed. If they're not followed, I'm going to have problems. I'm going to get mad. And I can come to you and you're going to help me, right? Because they're just not doing the rule 1 through 5. Task lists are incredibly helpful. Like if you have 4 students in a group and each one of them has a group of tasks or, they have to do to satisfy the overall requirement, that is incredibly helpful. And pick groups that have a clear delineation of group design. That's sort of like what you guys do when you name them or you base them on Harry Potter or whatever. I know you did, somebody did that at some point. I mean, maybe it was here or somewhere else, but that's helpful because it gives you some sense of belonging. And, you know, I'm in the Gryffindor group or I'm in the Marvel group versus DC group or something like that. That helps me quantify that in my mind so I can understand I'm just not it's a nebulous group of people who just wander in and out and have no belonging. You know, they shouldn't be here. I mean, and I'm not making this up. Kids do think that. Giving practice opportunities before doing a graded group, like it's just coming up with an artificial thing for them to do. It can be a very simple 5-minute activity, but Gryffindor group, go over here and do A, B, and C, and then bring it back to me. There's no grade assigned with it. You're just getting them prepared for the greater or the longer, more extended group activity that they're going to have to do. And those expected group behaviors enlisted. You will go to the next slide. I actually copied a very simplistic list. I mean, this is not rocket science, but it's something that you could do, and you can put more things on here, or you could change any one of those things, but that in and of itself will relieve a lot of problems that you might have with a student with autism, because they can look at that and say, remember what number 4 says, and that's what you're doing right now. You're copying my work. Number 4 says you're not supposed to do that. And if you have questions, don't ask me, because there it says in 5, don't ask questions. If you have questions, ask somebody else. But you can do this for any task, anything that would be helpful. You know, if you have classroom rules, and I know you guys feel like you have kids that are older and you don't have to do these things anymore, but if you have a student with autism, it still is effective. It doesn't work. So. Ways to help students socially. Well, you can send all of them to me, and I'll come to my social skills group. I would love to have them. But that's not always an option because their groups are rather large and I can't accommodate that many kids. Probably the most I can handle at any one time is 10 because we do a lot of fun activities, and when they get really jacked up, then it becomes much more difficult to manage. So this goes back to what I was saying earlier. Just because they have the knowledge does not mean they can apply it. So just because I know that I should not look at you and say something inappropriate does not mean that I'm not going to do it. Or if I know that I'm supposed to come up to you and say, hi, my name is Michael, that doesn't mean I'm going to do that either. And I might just start talking to you like I already know you because you're in the group with me. You must know me, right? You already know me. We feel the same things. We think the same things. And I'm, again, I'm maybe being a little bit sarcastic, but that is actually what people with autism think, that you're in this group and you already think and feel like I do. So and of course we know that that's not true, but you have to specifically teach that. Model what you want them to do. So in all the groups that I have, I always show them what to do first. So if it's about meeting somebody for the first time, I'll show them, I'll have somebody sit down and I'll say, hey, my name's Michael, it's good to meet you. Oh, I'm sorry, I must have surprised you making like weird eye contact. Okay. And I'll say those things, like I'll get them to look at, what the person's doing and how they react and things like that. I want them to start being observant more socially because that is what they have trouble with. And I might say, all the things I just said about that contact I had with that person is not stuff you necessarily have to say. You just think it in your head. And there's stuff about the eyes and everything you don't have to say. And then what you do is assign somebody, if there's somebody able. It'd be great if Mountain Sales had some kind of mentoring program. Yeah, that's another thing for us to do. Oh, great. But if you had some students, especially there's a lot of students who have autistic siblings who like doing this kind of stuff. They like being helpful and being social mentors or whatever. If you can find some students like that who want to be, that support group or whatever, it doesn't have to be you don't have to be like this 24/7. You don't have to be together all the time. But teach me what I'm supposed to do. What am I supposed to do when I go to the cafeteria? Am I just supposed to stand here and just stare at everybody, or Should I go in that line over there? Where should I go after I finish the line? You know, who should I sit with? How do I make choices about where to sit? You can't assume that I know any of these things. So sometimes having a social mentor or buddy would be helpful in that regard. And maybe they can even, you know, earn volunteer hours. If you guys come up with a mentor program, I mean, I'll say that you work for NAPSA all day long. You know, if it's helpful to another student, I'll be glad to do that. You get volunteer hours for doing that. We actually have, Central Georgia Autism has Christmas programs and all kinds of stuff where you can get mentor hours or volunteer hours. I know the students in the upper school have to do that. So if you ever have questions about any of those things, I would be more than happy to help you with that. And then refer to a social skills group. The only ones that I know of right now are mine, and there's a lady named Monique Moore, who is a licensed clinical social worker, and she has social skills groups, but I'm not really sure what age she has. I know the ones that I have would be the most appropriate for the group, the kids that you work with, because I have a preteen group, again, a teen group, and then a young adult group. So, and if you can't get in right away, maybe you could get in the future. So one of the things that Ms. Alderman suggested I'll help you understand is recognizing social stress or stressful reactions. So think of, everybody has anxiety problems to some degree. Anxiety is the most common thing in the United States. It might not be out of control, you might manage it, you might do well with it. But think about if you had very poor coping skills, or you had poor ability to manage your sensory input, or if, again, people are always doing stuff that you don't want them to do. They're always not doing what you need them to do. They're touching your stuff. They're not following the rules. 1 through 5, they're not doing it. So that creates a lot of stress. So students with autism are obviously under a lot more stress than most students, and they work very, very hard most of the time to keep it together, and then they let it fly when they get home, which is what I see a lot of students for. How do we stop doing the program, letting it fly? Well, for one thing, you can start teaching them more coping skills during the day so they're not so stressed out, and that giving them a place to go, or giving them people to talk to, or mentors to be associated with. Common signs are more frequent reactions. Like, for instance, if Jim was doing fine for the first 3 months of school, and then all of a sudden anything you say to him is like, bam, or it's like a throwing a pencil, or like, I'm just not doing this anymore. If it's an extreme reaction that you're not familiar with. Now, it could be normal development. It could be the honeymoon period's over. I don't like you anymore. You're a teacher. But it might not be that. It might be a confluence of things where starting to have stress with other, peers. I feel overwhelmed because of the academic demands, that they're hard. I don't know how to manage these things, organize these things, or whatever. So there could be stress, and it could result in sort of extreme reactions. And obviously, the other also could happen. You could have students who withdraw. They move away. They don't talk to anybody anymore, or they try to sit off by themselves. They eat lunch in an isolated area. And I know there's other mental health conditions that could be associated with those things. And people with autism have a greater chance of having other mental health conditions. There's a 33% greater chance of a student with autism having depression or anxiety or whatever. So it could be a sign of something, or it just might be a reaction to stress. Lots of declines, and this thing is not working the way you want it. Lots of up and down, up and down. In academic performance is one way to see stress, the reaction to stress. And then increased verbal aggression. Again, even if you don't see it at school, if the parents coming to the teacher the next day like, what are you doing to him during the day? Because he just comes home and he wails on me. Like, he makes all these inappropriate comments and he's calling me names. And like, that's not my son. I don't know what y'all are doing, but that's not my son. And then behavior designed to get students suspended or disciplined, and that's what I was talking about earlier. Some students would rather go to ISS or be put out of school so that they don't have to deal with all of it. Now, I mean, that might be an extreme, but I'm sure that it happens quite often. Oh, wow, way too many things on this slide. All right. Okay, so crisis management. A lot of people, I get asked to talk about crisis management a lot, but the best way to manage a crisis is to not have one. So to have proactive strategies to where you would minimize problems before they actually occur. And that's great, that's ideal, but crises are going to happen. So I will tell you, not even looking at those slides, I will tell you that this is what happens commonly with a lot of students I work with. So for instance, I have Asperger's disorder, so I'm going to sit down and I'm doing something that I'm not supposed to do, and then you're going to say something to me, and I'm going to continue to do what it is because your information didn't fit with what I think anyway. And so I'm going to continue to make noise and do stuff like that. And then you're going to get louder and you're going to yell at me across the room. And then you're going to threaten me with a consequence. And I have one or two reactions. I can de-escalate myself, or I can go off. And going off could be like I'm going to mumble, like comment, whatever. And or I could do like this, or whatever, to show you my disdain for what you are doing. And a lot of times it gets exacerbated, especially if there are other students around. Like, I know you can't isolate students all the time to do discipline, but people with Asperger's disorder are extremely sensitive to being socially criticized. Like, that is one of the top 5 things. If you call me out or criticize me in front of other people, I have basically 2 responses. I shut down, or I react in a verbally aggressive or violent manner. And so that is typically what happens. Now, that doesn't mean that you can avoid criticizing people, obviously not, but it depends on how you do it. And I will tell you this, if you've ever met a person with true Asperger's disorder, their brick wall is thicker than your brick wall. And there's nothing you can do to get through that. If they put up their brick wall, there is absolutely nothing you can do. So arguing with them does not work. They are the best arguers in the world. So what you should do is realize that you're not in a competition. You don't have to win. You just have to de-escalate the situation. So if you need to get the person to say, I know you're really feeling bad right now, but we probably should go outside and sort of keep it down low where they can hear you and not all the other students can't hear you. It'd be great if you had a preordained signal where you could say, something like that. That's often what I'll do in a group. I don't even have to speak in the groups that I have. I don't even have to talk anymore. I just and so we'll go outside, we'll step in the hallway and say, what are you doing? No, I'm not doing what I'm supposed to be doing. What are you doing? I'm yelling and I'm talking over people. Yes. Okay, I'll stop. Okay, let's go back. So I might have to do that once or twice, but it is extremely effective. Or I'll walk up to people right behind them while they're in the group and I'll say, please stop doing that. And especially if I whisper, it's much more effective because they've heard yelling their whole life. So whispering is extremely effective. I know you can't do all these things in a classroom, but it does work. So, and I know you're not going to be in the habit of making all these reward programs and going back to the old days of 2nd and 3rd grade where you have reinforcement programs or whatever. But I will tell you that if you had something on the side where you like working with a student with an Asperger's disorder or whatever, and you said, if you're able to contain your verbal insults in this 45-minute period, there might be something waiting for you in the drawer. That is a reward because you set that up beforehand. A bribe is different. A bribe is, will you please shut up and I'll give you whatever's in my drawer. Okay, that's different. But if you say beforehand, I'm going to work with you, but I want you to try to cut out all the things that you say that are negative. And if you can do that for the 45-minute period, you can go to my desk and pull it open and there'll be a reward. And it's something that you and the person have already come up with that would be rewarding. I can tell you, the reason I mentioned Pokemon cards is I buy Pokemon cards in lots, and I give them out after every group to the ones that want them. I don't even have to mention the rewards anymore because they are extremely satisfying, even for the ones who don't collect Pokemon anymore, and even for the adults who say, I don't need them anymore. They still come up to me and whisper after group, hey, can I go to the room? You can go to the room. So it does help manage behavior. So like I said, I'm not here to enforce the value of reinforcement, but it is incredibly effective, and it can be done on the slide. You don't have to have something, great formal, and you don't have to do it for everybody in the class, because not everybody's going to like Pokemon or comic books or whatever you decide. But it is effective. And sometimes you only have to do it for brief periods, very short periods. You might do it for a week or two. And maybe not every day, maybe every other day. But any kind of reward system like that will be effective. Another thing that you have to realize is sometimes when a student is all worked up, they are not going to be able to go back to class. It is not going to happen. There's nothing you can do to break that hour long, I got to go through this, I'm gonna be problematic for the next hour. There's nothing you can do. And a lot of times parents will tell me that, like, we just go into their room, they'll sit, they'll calm down, they'll come out and they'll apologize and say, can I come back to the real world, or can I come back to the family table? Yes. And it's tricky because you're the ones that are gonna have to figure that out. Like if that happens, like just talking to them is the act of aggravating the situation. Don't do it. If you know that it's already escalated to the point where it's going to get scary, or just say, we got plans for this. Let's go, and just mirror a calm voice. Let's go over here, and you sit out here in the hallway, or you sit with a secretary, or whatever you need to do. And then I'll come check on you in a little while, and we'll see if you're ready to come back. As simple as that. And it's easy for me to say, much harder for you to do. Remain calm in those situations, because once you raise your voice, it has a synergistic effect. It amplifies and creates problems, situations. So I have learned over the years, even if I'm extremely angry at a student because they did something that hurt me or personally violated my beliefs, I still remain calm and say, remember what the rules are. What's number 1, 2, 3? So. This is ideal. Now, this is where the problems can occur. Allow the student to remove themselves. This is what they do in Houston County through their IEP program. And the student can go to their sensory area. My concern is, well, they've acted out, they've created problems, they get to go to the sensory room. I know what we're doing here, we're trying to de-escalate, but they're getting rewarded for like acting out. That makes no sense to me. So from a behavioral standpoint, that sometimes is not what you want. And another thing is I am very mindful of this. So like for instance, the group room that I have is probably not bigger than that room in the back there. And I try to jam like 10 kids in there. And sometimes it's challenging, but I always respect their personal space, because I know that if I get up on them and I touch them, it's going to make things worse. Like sometimes I might just gently put my hand on their shoulder while I'm whispering in their ear or whatever. But if I actually go up to them and grab them like this, I know what's going to happen next. And then, I might have some aggressive behavior. So you want to be mindful that the sensory issues also include physical touch and closeness to other people. You might be a foot away, but my personal space is 15 feet, and you're within my 15 feet. So, okay. So it's always tricky, again, going back to whether parents want to share the diagnosis that has a beneficial effect. But to me, when the cat's out of the bag, parents are more willing to communicate with the school is able to more effectively communicate with them. I think it creates a win-win scenario, and problems typically do not occur because the parents work effectively at home. The school is able to know what to do. And that creates a much better scenario. The biggest problems that I see is when parents don't want the school to know, or the school already knows, and they just don't want to give a diagnosis out in the open, and then they want to not ask for any accommodations, but they want accommodations. Like they want you to ask them if they need accommodations. They can't say, well, Jimmy needs accommodations for writing. They want you to ask them if Jimmy needs accommodations for writing. I mean, it's complicated, but I see this a lot. Now, if you've ever seen my reports, I will say at the top, go ahead.
So, and I know that we've all seen this, we've worked with kids that have a diagnosis, and then we've worked with kids with no diagnosis.
Correct.
But we as experienced educators, we know.
Right.
how do we handle that? Because I know that for some parents there's such a stigma, and you're thinking, I'm already putting all those behaviors in place as a teacher that I know, I need to repeat an instruction or give a clear instruction. Do you have a way of helping to communicate with a parent that maybe it would be beneficial for them to get a diagnosis?
So I think I have some slides about this, but what you have to do in that situation very gently is not talk about a diagnosis and say, the people at the Autism Center, Autism Development Center, they don't just work with kids with autism, they work with all kinds of kids with anxiety problems, depression, learning problems, or whatever. They don't care about the label. They want to figure out how to best help your child be optimal at home, at school, or wherever. So you can say, I don't really care that you go to Dr. John's and get a diagnosis. I want you to find what's best for Johnny to do his best in this classroom or in all our classrooms. So, I would try to stay away from a diagnosis if there's not one that's open. And something I was thinking about this morning that I didn't put up there, there's another diagnosis that may be appropriate in your setting, which would be called social pragmatic communication disorder, which is a fancy term for an old diagnosis, which is called pervasive developmental disorder. You don't feel it really fit all criteria for autism, but you do have some social skills problems. So you don't necessarily go around flapping your hands or whatever, but you do have some social weaknesses that need to be identified through a diagnosis. And so a lot of kids may fall into that category, but again, how are you going to approach that? Like, Dr. John's told me about this cool diagnosis. I think it really fits your child. No, so I would just tell them to stay away. Just don't even talk about a diagnosis unless it's out in the open and say, I don't know what's specifically diagnostically going on, but I know that we need to do something to help John or Tim or Jane or whatever do better. So it can't hurt to go down there. The information that Dr. Johns gives you is yours. You're the gatekeeper. You decide where it goes. And if you don't like it, tear it up and throw it away. But if it is helpful, then you can give it to us and we can say, hey, we can do this and this and this. Or even if it's not, he can refer you to somebody else who might be able to give you more information, like a speech therapist. A lot of times, the speech therapists we have at NAVCENT are trained in working with social communication disorders and things like that. So they might just give you a list of things you can do to take to school with you or take home with you. So I thought about that when I was coming up with this last night because, like I said, I do what's called a school version of a report, and that's usually an instance where parents want me to take out a diagnosis, where they don't want me to put in certain kinds of information. Like I do a lot of personality evaluations, and it's where, like students reveal what they feel about themselves or what they feel about their parents or what, and parents are like, I don't want that in there, so I'll do what's called a school version. And I understand the relevancy of it, but then they get very nitpicky about what they don't want in there. Like, I don't want them to know that, Tim was bullied when he was in public school before he came, over here. Well, I think that information is important. It has an extreme relevance to how he relates to other kids in your setting. So it's a tricky situation.
Can I mention something along with what you just talked about? Back when I was in public school, teaching in public school, I had a fifth grader who clearly something was going on. He'd gone all the way through elementary school and it had not gone on undiagnosed up to that point. And I nearly got in trouble because I said to Mom that she go look at this website, which happened to have a questionnaire on there that she could answer questions on. And she told me later that she did go on that and she ended up getting him help and found out that he did have Asperger's. And she was relieved.
Absolutely.
Because she never knew what was up with her son and she didn't know what to do. And then she knew.
I can tell you 99% of people that come to see me, if they get a diagnosis of Asperger's or autism, they are relieved. They're like, you know what? Now I understand why he or she behaves like they do. Now I'm not just blaming it on bad behavior, or they're just a bad kid, or it's my husband's input genetically that caused all these things. So yes, but people do get in trouble, and then it's really pediatricians are being asked to do more and more. Like they're being asked to fill out an autism screener or an ADHD screener or whatever. They're doing a whole lot of stuff that they really weren't even trained in. So people get mad and say, my pediatrician should have caught this when he was 8 months old or whatever. I'm like, they can only do so much in the, so. Back to the slides. standard disciplinary procedures. You do have to discipline everybody, regardless of whether they have autism or whatever they have. But again, if your approach is purely confrontational, it won't work because they can out-confront you. I'm just telling you from experience, there's nothing you're going to do. You have not met a more stubborn person than a person who's angry and has Asperger's disorder. That's just like nothing. And Carrie is another one. She gave me this idea about supporting versus enabling. So if it's something that would be written down in like a 504 plan, you're not necessarily enabling anything. People often worry that I'm making things worse. I'm making them dependent. If the person won't do it on their own, and whatever you're doing is helping them do it, then you're not enabling. You're helping them do a skill or behavior that they absolutely will not do if you're not there, or if we don't have this accommodation in place. So I would not even worry about enabling anymore. They will adapt and grow as they need to. Most of the students that I work with do go to college, or they have the aptitude to go to college. But if they're not going to ride a bike at 6, nothing you can do. And enabling them, like, okay, and is it wrong for me to push them down the road? No. What's wrong with that? But you might push them down the road for the next 3 years. It might not change. It's okay. I mean, but you have to remember, or enabling for the writing thing. You can just give that up. It's not going to change. I mean, okay, well, I'll write it out for him. The parents worry about this a lot. I'll write out his homework. No, give them a laptop or iPad and let them do it themselves. Or use Dragon Speak. I mean, it works phenomenally well. I mean, writing out something is enabling, but you know, if you want to show them how to do it without you present, then you have to actually give them the tools to do that. So, and there's also a thing about, you know, people with Asperger's disorder can be defiant, they can be manipulative, they can act out, they can want to push your buttons. If you show me a lot of buttons that you have, I'm going to push them all the time. I mean, 'cause I want some entertainment, especially on the way home in the car. And so, let's say, Mr. Rogers, you don't really like cursing in class. And I know that's one thing about you that you really don't like. I'm going to curse in class. And it's not because it's just one of those boundaries. I'm just going to...
You'll push my button.
That's right. And so if the way for you to manage that is to just like, you know you're not supposed to do that. How could you do that? You know that's one of my things. Well, you've already lost that. You've already identified that that's one of your things. You know, and I'm going to remember that forever. Because people with Asperger's and autism have phenomenally good memories for stuff that you don't often want them to remember. But,
I'm just whispering in their ear.
Yes.
I can see Mr. Barney.
There you go. That works. And he's going to tell you what it is that you did that you weren't supposed to do.
And if that don't work, I see Mr. Bell.
There you go. So sometimes you have to be creative about managing behavior because, again, if your approach is primarily confrontational, it won't work. And punishment does not work at all. I'll tell you that. Now, punishment may not be the same for a neurotypical person as it would be for a person with Asperger's disorder. If you take away my Xbox, my PlayStation, my tablet, that's the end of the world. I have nothing else. But I'll sit in my room for 3 hours just twiddling my thumbs. And then when you come in 3 hours later and say, are you ready? You apologize? Mm-mm. Because my will, my ability to withstand is much stronger than yours. So, standard punishment doesn't work. Spanking doesn't work. Taking everything but the electronics. Now, electronics does work. I'll take it out. But most of the time, parents overdo it. They'll take it for like, I'm taking your iPad for the week. What are you going to do for the rest of the week? Like, what are you going to use? That's the only thing you've got. So use it very judiciously and use it in very small doses. Like I would say no more than a day. And you say, well, they're like 14, they should be able to manage like a week without an iPad. Yeah, but you've got nothing to motivate their behavior for the rest of the week because they don't care about anything else. So, all right. Yeah. get back to my, I must have put that writing thing in there multiple times. So I'll tell you a little story about the writing thing. So some people say they just don't like to write, but I had one kid who literally said that he could hear the graphite coming off the pencil. I'm like, I can't tell you that you're lying. That's a great description of why he didn't like pencils. And then I said, well, you like mechanical pencils, and they're still graphite, and it still comes off. So he said it doesn't come off quite so loud as it does with a regular pencil. So how to refer a student for evaluation and treatment. Again, that's what we were talking about earlier. So you want to refer to a specific behavior, a specific concern that they have. They're not performing well in math. They're not writing, up to expectations. You're afraid that they're not going to pass the year-end tests. They don't talk to people. That was one of the last referrals I got. The child knows how to talk just fine, but refuses to talk at all at school to anyone. Even though they can function just fine, they can talk fine. So if you go down that road, then you won't have to make a label. You won't have to say, I think your child has Asperger's disorder. But you can say, you can say things like, I think students who struggle socially also struggle a lot academically later on, and so it might be good for us to try to figure out what this is before. Now, the trick that I have is, a lot of times if I say that, especially at other schools too, is people have concerns with our name, NAVCENT, Autism and Development Center. They immediately we get phone calls all the time like, do you do anything else but autism? I'm like, yes. Okay, Autism and Development Center. So yes, we do other stuff. We do, I mean, I work with kids with anything, the whole range of things, but because of that, title, people think that we just do autism. So you can assure them that that's not the only thing we do. And Dr. Johns' job in life is not to find autism in 100% of the kids that he sees. And the second line is to make sure that you tell them why you think it's important to have that evaluated, because you think that long term, because Jan is not talking to other people in class, she looks like she might be a little sad or whatever, and it's not working. Don't use depressed. She doesn't look like she's happy here, so I'd like her to feel a bit better and be more part of the group. Maybe Dr. Johns will be able to tell you why that is, and she's having such a hard time. Maybe it could be anxiety. Maybe it could be social stress. Maybe she's upset because she's not performing like the other kids. I mean, that's extremely common, is kids having problems because they feel like they're not up to par with everybody else. And I did write on here, make sure that they know we don't do just autism. And another thing that parents come in concerned about is they don't want me specifically to give their kids medication. Well, the problem with that is I don't give medication, so I'll say, well, I don't do that anyway. But my job is to find all the interventions and all the supports that will help that child in lieu of medication. I mean, that's not my goal. I don't really want your child to take medicine, but I'm going to identify everything possible that's going to help them. Supports, environmental accommodations, anything that I can find that's going to help them be their optimal at home and at school. And then I did put our number up here, and then I put my number, 653-8167, so if you want to call me specifically, if you have any questions, I would be more than happy to discuss anything. If you're too shy, if you have your own social problems, you can call Nikki, who's very kind. She's the front desk secretary, and if you didn't have social problems, then you might have some, because Nikki's kind of very forceful and aggressive. No, she's great. Is there anything else? Okay. I did list on there some reasons why you might want to refer and who you might want to refer to. So in our center, we have a developmental pediatrician, me, a psychologist. We have a social worker who does therapy. We have a psychiatrist who does testing for me. We have OTs, PTs. If I'm using acronyms you don't understand, you can just stop me. And speech therapists. All of them are trained just incredibly well. So it's not like you're going to somebody in the community who doesn't know what they're doing or how to work with their child with multiple different things. All the people that work on center are extremely well trained. If you have a child with anxiety problems, and if I refer them for a speech, it's not because they can't talk, it's because they might be afraid to talk, and so a speech therapist can help you with that. So there's a lot of different things that we can offer you in that center. For those of you who don't know what a developmental pediatrician is versus a regular pediatrician, so Dr. Young is our developmental pediatrician. She does not do common colds, splinters in the feet, whatever. That's not what she does. What you go to her for is mental health conditions. So she's not necessarily a psychiatrist, but she does work a lot with developmental conditions, anxiety. She prescribes a lot of ADHD medicines, but she also does very thorough workups. She also works with the schools, does calls to the schools. She's probably the only pediatrician that I know that actually will call the school, say, hey, you guys, can you try this or can you do this differently? And oddly enough, I think at one time she lost her mind because she actually stopped being a developmental pediatrician and went to teach at FPD. Like, how do you just stop being a doctor and okay, but she decided that's what she wanted to do. She did it for a year or two, and then now she's back with us. Which
Was the joke that she went to FPD, or was the joke that she went to teach?
double entendre. But yeah, I was no, you gotta be kidding. Like, where is she really? She's a teacher. She's a science teacher at FPD. Okay. But she felt like it was her calling. She wanted to do that. She's always wanted to do that, so she did it. Speech therapists. So if you go to, like for instance, I was saying earlier, if you go to a speech therapist in the community, they may not have a lot of experience with a wide array of things like some of the ones that we have at our center. But the other thing you have to know is, for instance, if you had kids that are in public school system and they had a speech therapist in public school, so their job is only to get you to be able to function in that one setting, and they don't care about anything else. They have very strict criteria for kids like getting out of their services. So you're like, well, he still doesn't answer questions very well. Can he answer a question? Yes, you're done. So I might be a little extreme in that, but it is very true. There's a huge discrepancy between what school-based, public school-based therapists do and what the others do, the private or the clinical therapists. So that's even true for things like occupational therapy and physical therapy. So if somebody comes to your classroom and says they had a history of speech therapy at school, you might say, well, you ever tried going back? No. They might benefit from some more speech therapy in a clinical setting because their therapist might have some other things that they can teach them. Physical therapy is a hard thing to find in Middle Georgia, especially for kids. So it was OT for a long time, but now we have an OT. There's another OT on Arkwright Road, but physical therapists are hard to locate. I mean, I don't know what the problem is. There's not a lot around. And so sensory problems, I don't know if you guys are familiar, but in the past, therapists use things like weighted blankets or weighted vests. There's a brushing program called the Wilkes-Barre program that they used to use to desensitize your skin to touch, things like that. Speech therapists and occupational therapists are often trained, like the ones at our center are trained in doing those kinds of protocols. They may just give you a list of things to do to de-escalate those kinds of problems. So they might, what I used to train parents to do is carry around a sensory bag. So if you have problems in the car every day riding home or going to the restaurant or whatever, have a sensory bag that has like manipulatables, like things you can do with your hands, things that you can play with, fidget with, something very powerful like warhead candies, something extreme. Those kinds of things will break the cycle of like, I'm used to like causing problems in the car and I love doing this. You can stop those cycles by providing those extremely sensory stimulating events. So. And the last one. Oh yeah, I did. If anybody here is big on like references and like doing them properly, I'm sorry. That's what I thought. They're not in APA form, I understand, but they're there, and I just thought it would be better to provide them to you rather than. Autism Speaks, I just put that out there as a website. I mean, I didn't necessarily utilize that website a lot, but we actually, the materials that we hand out at the center are from Autism Speaks. This is a book that we give out to families for school age and above kids. It has a lot of helpful information about what therapies there are available, what to look out for in terms of education. So I brought some up here that you could keep here if you needed to. They are appropriate for middle school and high school also. There's stuff in there that you can utilize. If you ever want to know, Tony Atwood, who has 2 books up here, because I have probably every book that he has, is the world's expert on Asperger's disorder. He's from Australia. He's extremely funny, but he knows so much that it's almost like, wish you could take that person and like carry him around with you, especially at work. But the Complete Guide to Asperger's Disorder, the one that's 2008, is the one that he wrote, and it's had multiple revisions, but it has little sections in there about how to help students with language skills or motor skills or social skills. So each section has a little key things you need to remember. And I'm sure writing is in there somewhere. And so it goes through and it describes a lot of things that you need to watch out for. There are great websites. Just stay away from the websites that say, I can cure autism in 10 days or those kinds of things, because there are those out there. And that goes with any kind of mental health condition. I cannot cure autism, I cannot cure ADHD in 10 days. The ones that are the best are the ones that are affiliated with a major university or with the Mayo Clinic or the National Institutes of Health, National Institute of Mental Health. So, questions. I got like 15 minutes. Those are good questions you asked, by the way, earlier. If you never had a student with Asperger's disorder or autism, you will. I mean, the statistics say that you will. You may not recognize them, and their parents may not want you to know, but you should know that they're going to be in class.
I have a question.
Yes.
There's a common expression like, you just hear it all the time, that kid is on the spectrum.
Mm-hmm.
Well, how far on the spectrum do you have to be before we really notice something in a typical classroom? Like,
A lot of students make it
really
through.
expected to know low.
No, you're never going to see those kids. They're never going to come to you because they're too disruptive or they lack significant communication skills in order to function in a regular classroom. So, like I said, the majority of kids are milder or Asperger's disorder or high functioning autism. Those are the ones you're going to see. You're not going to see the other kids because they're going to go to a different school. They're going to be in a self-contained classroom in public school. A lot of kids make it through without needing anything or without having a diagnosis identified. I mean, I have 2 or 3 that I worked, that I've recently diagnosed, but they were in college, but they made it through because they were intensely intelligent. They had some people who really cared about them, who helped them with coping skills or said, if you have problems, just come to my office, just sit, you'll be fine. So they had somebody that helped them work on coping skills, but they didn't necessarily need anything else. Now, the saddest thing I will tell you is, and I will tell you this only because there are some bad stories. I worked with a student one time he graduated from high school when he was 16. So he was probably the smartest individual I've ever met. So then he applied to college and he got in on a full scholarship because he made probably a perfect score on his SAT. And one of the first classes he took was advanced thermodynamics, which I don't even know what that is. But that's the first one he took, and he made all A's in that class. The only trouble he got into a little bit was he didn't like doing his work. He just knew the answers. I mean, he was very right-brained. Right-brained people, they know the answer. They don't have to work it out. They just, it's 3,478 times whatever. And so, but they didn't think he was cheating or anything. He was just very bright and could answer all the questions without working them out. But the problem that he got into was one day, the students and the professor were chit-chatting, and they were just fooling around. So he got up, and he used profane words and called the professor a lot of bad names and said, you guys are wasting my effing time, and let's get back to the lesson. So the professor said, bye, see ya. So he sent him away. They had not identified him as having Asperger's disorder at the disability office, so they, in some ways, I guess they thought that they were faking it or making it up, but he was expelled from college. They asked him to leave. If he had, been identified, maybe the coordinator could have said, yes, this student does have Asperger's, and he's really sorry that he said that. He won't do that again, and maybe he could have gone to apologize to the professor, but his bridge he just had one bridge, and he burned that one quick, and that's unfortunate because he was probably the most brilliant person I've ever met, and now he does nothing. He stays at home, and because and now he has a track record. The other, they'll say, well, can we have your transcripts from the school that you went to? Well, why won't you give us the transcripts? Well, they might not look so good, or they might say, verbally attack the professor. But those are far and few between. Those are the majority of cases, and the majority of kids go through college and they do fine. It's really adapting at the college level that they have a hard time adapting to the social part, or adapting to the fact that I got to make my own bed, or wash myself, or wash clothes, or get my own food. Those two kinds of things I have trouble with. Yes?
We ran into something with one of our 6th graders today. It was pajama day.
Oh,
And
yeah, I can
very
see how that's going to
literally,
be a
he came
problem.
into my room, got a pillow, laid his head down on the desk for homework, and took a nap. And he was, because he was in his pajamas, that's what you did.
Absolutely.
And later on, I noticed he was having these behaviors in other classes too, so I pulled him aside and I said, look, I know you normally sleep in your pajamas, but you can stay up late. And he was like, he woke up and he stayed up the rest of the day. Because he had permission to.
Yeah.
He needed that permission though, because he sleeps in his pajamas.
Right.
That's what he does.
He has that state.
Yeah.
Yes. You put him in a situation where he needs to go to sleep,
Yes.
or at least not function at all levels. And
Yeah.
that's a good example.
Yeah.
I see.
Either one, I'm fine.
It was funny when you were saying, unstructured time.
Mm-hmm.
We have a student who I believe has absolutely no diagnosis.
Mm-hmm.
But this year, this student is a junior, and juniors have a free period. They can go anywhere they want. They can do anywhere they want. And I don't teach this person this year, but for at least 3 days, they've come to me and said, can I sit in your room? Because I have a free period. And I'm like, well, this is my free period, so I've got to go and I've got to do this, and so this might not be the best room. But every day they come back and they go, can I sit in here? And I'm going, yeah, because and I know that this person really needs structure, but the fact that we've handed this unstructured day over is completely messing with their equilibrium.
They may have a diagnosis, That's a good example too. Not being able to manage, free time or structured or unstructured time. Another one that comes up often is creative activities. Like, you want to give the student a little bit of guidance and not a whole lot. You don't want to guide the whole response. That doesn't work real well with people with the autism spectrum. Like, I need you to tell me what specifically what to write. I don't need you to tell me write what you felt about this summer. Oh, that's not going to happen. Yes.
I have noticed a huge correlation between an ADHD diagnosis and autism, and I think sometimes we try to figure out what are we responding to. Is what we just saw impulse control, or was what we just saw a diagnosis? There's no way, like you said, you can argue with condition,
Right.
versus you just mouth off and you just merit.
Well, the problem with a lot of people that have autism spectrum disorder is that they don't respond like neurotypical people to medication. So they might respond, not fully or only partially. So you might have some improvement in blurting out, excess verbalizations, getting up, running about, but you're still going to have poor organizational skills, trouble getting started on stuff, trouble stopping behavior, all those kinds of things. And sometimes they have paradoxical effects, which is they have the opposite reaction to a medication. So if you give a medication to tranquilize or calm down, I might get all worked up and I might go attack people. You know? Or and it could be as simple as I can put something on, give me something to put on my arm for eczema, and it goes all over my arm and all over my chest. So it is trial and error. That's why I'm glad I don't do it. That's Dr. Young's area. Anybody else got any questions?
Thank you, Dr. John. Appreciate it.